Yeah, so parents can determine what happens to their children by their lifestyle. Is that what you mean?
Absolutely. So this is what I really focus on, helping people to understand that, if they make an effort to improve the level of their own health and try to heal through various different issues that might be affecting their wellness and health, not just at the physical level, but also mental and emotional, that this stands to make a difference, not just in their lives and what happens to them later in life, how they go through the menopause, the andropause and beyond, how they experience being pregnant, what happens postnatally. That's another huge subject that we can get into as well. But also what happens to their children, the health of their children, which is absolutely predetermined by what's going on at the level of our cells and our sperm and egg specifically, and what's passed down to them. So yes, there's going to be certain genetics that they inherit, but there's also going to be a certain, though the epigenetic environment is actually reprogrammed at the point of fertilization, there are also certain epigenetic factors which are passed down, and interestingly are mainly related to the nervous system and our neurological processing. So this is where being able to do a level of healing that addresses trauma, that addresses adverse life experiences that we might have had, is super important, because it does also stand to benefit the children that are born afterwards.
Could this be the reason then behind the conception plan you came up with?
Yeah, you got it.
How did that affect the conception plan? How did it help you in setting up the conception plan?
So the conception plan was really born out of this need to want to merge and marry lots of different modalities and dimensions into what I was already practicing as a doctor. Yeah. And being able to provide people with a truly holistic approach that was able to look after and care for their health physically, mentally, emotionally, and also really importantly, spiritually as well, because conception is that unique point in time and that interface between the material realm and the spiritual realm. And to me, there is nothing more miraculous and more special than being able to commune with that process and to understand more about it, and to become an enabler for someone to be able to manifest life here on earth. So the period leading up to conception, which is the preconception period, is something I'm really passionate about promoting and supporting people in, because this is something that doesn't really exist out there. A lot of people don't really get taught the importance of the preconception period, which is at least 3 months prior to the lead up to becoming pregnant, but ideally, is a year or longer, where you're focusing around healing various different aspects of yourself in order to become the healthiest version you can possibly be prior to conceiving your child. And, this requires commitment. It requires someone who is already in quite an evolved state of being to be able to brace and approach some really difficult aspects that, they may have buried for a really long time. They may never have had the courage to witness before, where societies, had told them to carry on and be a certain way in order to succeed in life. Yet, they may have faced quite a significant level of trauma that they've never ever had a chance to address, and all of a sudden it's brought up through the conception process. And when we move into the phase of being pregnant and then giving birth, that really sacred point in time for a woman, and then the man who's supporting, or the partner who's supporting the woman who's pregnant, is so important, not just when it comes to the mother's health later in life and her whole family's health, but the child's health as well. And also, I would argue, our society's health too. Because if we don't support and look after our mothers who are giving birth to the future generations, they, as we are seeing through statistics that have just recently this week come out in the US, maternal mental health is at an all-time low. So it has significantly reduced since 2016, between 2016 and 2023. And where very few women are actually reporting good levels of postnatal mental health. And why is that? I think one of the main reasons is because there is absolutely no level of preconception support that is going on in terms of allowing people to understand the importance of investing in themselves prior to becoming pregnant. But even more importantly, of society's understanding the investment that needs to be made in that to support people to be able to have the care that they need to become pregnant, and then supporting people whilst they're pregnant as well as afterwards. And postnatal care, certainly in the Western world, is almost non-existent. Unlike indigenous cultures and other practices around the world where, there is a really, that there is a period of time, which is usually 40 days, that is given towards and invested in the woman who is recovering from birth, who has now become a mother, who has undergone her greatest life transition to date. There is an investment that's made societally, that's made, by families, that's made by all of the relationships that woman has in her life. Yet we don't see that. We don't see that in the Western world. And then we wonder why mothers are suffering so much, why families are suffering so much, and why so many children who are born out of families where, their mothers may not be able to care for them and to provide for them because they're debilitated by a situation that they're dealing with, end up and go on to also have issues and problems themselves, whether it's with their health, whether it's with their physical health, their mental health, their emotional health. This is all because there is no investment made at that preconception point. And if you speak to people, as I have, who are sociologists, who are people who are caring for children that may be having behavioral difficulties and issues later in life, all of them will tell you that actually from all that they've seen and done through working with these children and the families goes back to the point of conception, preconception, and how the mothers were supported and looked after when they were pregnant and prior to that. And I think we have to start admitting that in our societies and getting very real about the fact that at the moment, something that stands to influence so many generations that are coming after ours and the generation that we currently exist in has absolutely zero investment and support when it comes to the Western world. And that has to change.
That is incredibly insightful. And we're going to explore a whole lot of things you've said here. I think there is so much to unpack in what you have said so far. But time constraint is a factor for us today. So you're going to come back on this program. You're going to come back to GLB Podcast to pick up from where, we're ending today. But there is so much here. If a woman, for example, has gone to the hospital, done all the relevant tests with the man, and the hospital says, both of you okay, So, and the question is, why are we not then conceiving? What is the problem here? And what you are saying so far is that it could be other things other than, medical conditions. And these other things can be, psychological, it could be spiritual, it could be any other thing, in the process. So tell us a little bit, how does the conception plan work? How does it work?
exists in a couple of different formats at the moment. So the first one that people might be most familiar with is the book that I've written, which came out right at the end of 2023, and which goes into detail on some of the subjects we've covered here, like epigenetics, the role of trauma, and then various different conditions that we've also mentioned, like PCOS, endometriosis, and really importantly goes into detail over the emotional lens and contributing factors that could be having an impact on someone's ability to conceive. But in addition to that, it also has a 12-week program embedded within it, which is a practical program that people can follow and addresses the 5 main pillars of health and reproductive health in particular. So they are diet, exercise, stress management, toxin-free living or reducing the chemical burden you're living under, and sex and relationships. So all of those 5 pillars are integrated within the 12-week approach, as well as self-affirmations and practices that I teach people how to do to be able to literally spend no money if they don't have it or don't want to, and just commit to a process at home that they do themselves to improve their natural reproductive health. Now, this also goes for people who are doing IVF, who are doing IUI, who are using other reproductive technologies where there may be a very real need for that. All of these techniques also complement what's going on there and attempt to give you a better outcome and a faster outcome as well in terms of what you're looking for when it comes to not just improving your health and your chances of conceiving, but also the health of the child that's born. And then more recently, I've just launched the Conception Plan program, which you can find details of on my website, theconceptionplan.com. And this is a program running over 3 months that brings to life all of these different techniques and methods and helps to support people who want a different approach to their health, who want to have a truly holistic, integrated application when it comes to dealing with a condition that they might have or helping to improve their chances of becoming pregnant. And I work with 4 incredible experts and coaches in this who are all amazing in their individual fields and cover all of the different pillars that I've mentioned within the conception plan, so they can offer that direct support to people regardless of where they live in the world, because you're a global podcast for a reason, and I really believe in making a business truly global so that people, no matter where they are in the world, can access this. And that's something that is about to start in June and that I will be running. And for anyone who wants to find out details, they can go online. And the final, iteration so far of what I am doing with the conception plan is also individual consultations for those who want to engage with these practices and really look at conception or their health through that truly holistic approach, multidimensional approach, shall I say.
Looking ahead in terms of innovation and in terms of transformation, what do you see as it relates to fertility issues, women and fertility issue? What do you see?
So I think if I was anyone else, the answer you would probably have to this question is going to be AI. Because that is what so many institutions are adopting at the moment. That is what is growing at a truly unbelievable pace, and it's making its way into all of our professions, including the reproductive and health sector. Now, the answer I'm going to give you is actually going to be one that's different to that. And in response to that, because I actually feel that the way we should be moving is very much more back to basics rather than becoming more reliant on these technologies. I think that the danger that we stand to encounter here is to outsource our power even more to these external technologies, believing that actually there's very little that we can do to help influence our health and conception. And I believe the opposite is true. I think that actually technologies should only be used as a result of an evolved level of consciousness and responsibility that comes through having really grown far more discerning over how we use them. Just because we can doesn't mean that we should. And
I like that. Just because we can doesn't mean we should.
Exactly. And if
what do you mean?
Well, I think that we have the means to do a lot of things at the moment, but there are a whole load of ethics attached to them. And the issue, one of the greatest issues that I believe we face with the integration of AI, if it goes on unregulated and practiced in a way that isn't congruent with ethical values, is transhumanism. And is, beginning to outsource something that is innately human to robotics and machines. And if we do that, I think we lose the essence of actually who we are on a human level, which is spiritual beings, bringing and helping to bring life into the world through a spiritual means. And, conception and the field that I work with is at the very interface of that. And I think that we have great responsibilities when it comes to being able to discern between what is congruent with, being a sentient human being and what is not. And there is a place for technologies, of course there is, in terms of assistance and help, but I think that the level of consciousness that needs to be applied to them is one that needs to be far more evolved and advanced than the one that we have at the moment, where the potential for distortion is pretty big. So to me, I would love to see a reclamation of power by the patient, by the people who need to be able to understand that there is so much that they can do to influence their own health and what happens to them and how they conceive, and to do that in a way that brings them back home, back to themselves, and to being able to do that via a process of healing that stands to benefit them as well as future generations, not a process of bypassing where we effectively bypass the healing element that needs to occur here, which does then have transgenerational repercussions that will at some point need to be addressed. But we have those responsibilities now. We have all of that information. We have a huge level of understanding on why it's important to address preconception health, why it's important to address our health, full stop, and what we can do about it and the consequences that has. And I believe that we need to use that information responsibly and in a way, especially when we're dealing with helping people to conceive future generations, in a way that honors the sacredness of that, rather than treating that as a purely mechanical procedure, which it is not.
When you talked about outsourcing what humans should do to AI, my mind just went to the robots I've seen on social media, who are carrying babies now, and like a science fiction. And we know that some of the science fictions, with time, people start experimenting into actualizing them into becoming real. And it has happened in space explorations and things like that. Do you see any future of that happening? Do you see robots carrying babies?
Well, I think it's already beginning to happen. I think Japan has just, if I'm not mistaken, reported that they've created the first artificial womb outside of the body, as in an incubator that is able to carry and support life. Again, it's going back to just because we can really doesn't mean that we should. And this has huge ethical implications, as has genetic engineering, as have so many of these biotechnologies. And yes, I mean, this is advancing at a speed that feels very alarming to many people before we've had a chance to have any real conversations over it and actually evolve our own level of understanding about the implications that this might carry. So I think we really need to be able to rein and draw this in and understand that actually this is happening at a speed which, if it goes on, will become unregulated, will start to be misused for certain purposes that it wasn't created for in the first place. And, you know, there is already evidence of that, as you say, across social media, across, you know, what is happening in so many other sectors where the potential for harm actually starts to really to outbalance what actually these technologies were designed for in the first place. So having the technologies comes with a great deal of responsibilities. And, you know, even in the practice of IVF, which has been going on for, you know, since the 1970s now, it's really, really important that we bring a level of consciousness to it where we understand that actually the way that it's currently being used, in my opinion, being overused a lot of the time, isn't necessarily correct, and that there is a whole process of healing that should also be going on behind the scenes to help people to have the results that they wish to have. So all of these technologies, no matter how long they've been around for, I think we need to refine our level of awareness and the consciousness with which we practice using these technologies.
My last question before I let you go today is this. For somebody on a fertility journey whose primary aim is to have a baby, what would be your advice to that person?
I think it would be to understand just how sacred and important a role being a parent is. It's really, for anyone who's been a parent, they will tell you it is the biggest role of their lives. And that carries many beautiful and incredible responsibilities. And along with that, there is a process that they can engage in to be able to, as one of my patients actually put it, and I will use her words, to learn to parent yourself again. And, you know, I think that's something that when she told me that and the benefit of working with me and the impact it had on her, it really touched me, because I think that is the case for a lot of people. It's learning to come home to themselves. It's learning to love themselves enough to be able to heal certain aspects of themselves, moving into parenthood and all of what that brings. And you know, it's also about understanding the spiritual role of what being a parent is about and how that gets to influence future generations. It is the most powerful role in the world. And I think it deserves the correct level of support and understanding as such, which is, you know, why all of what I do is about helping to support the parents of tomorrow. And even the meaning behind the conception plan, which a lot of people take to mean purely as just being focused around having a child, is about so much more than that. It is about the process of giving birth to yourself again and evolving and expanding the capacity within yourself to move from one state of being into another. So I'll leave you with that. I think for me, that's probably the biggest advice I'd give to someone moving into that super special role.
Amazing. That's it for today. Dr. Larisa, and it's been a pleasure having this conversation with you.
Oh, it's been my pleasure.
I look forward to another conversation of this nature, because you've opened a lot of channels that need exploration. So we will talk about it again. But for now, thank you for coming, and it's been a pleasure.
Thank you so much for having me, and to be continued.
Yes, to be continued. Take care.